branch, the CPD event of Northern Cape branch. I just want to see the numbers. It's climbing. We've got 60 odd participants. While we're waiting for the participants to log on to the Zoom platform, just some announcements. I want just to advertise upcoming events on the 25th of August. It's the Mpumalanga branch CPD meeting where Dr. Howard Luckman will be talking. On the 26th of August, there's a financial work stream from Deloitte. And on the 27th of August, it's the Young Dentist Council meeting that will be viewed then. Just some house rules. Don't use the raise hand facility on this platform. Use the question and answer. Type all your questions, and at the end of the presentation, we will go through some of the questions and ask the panelists to answer the questions. The certificates for this CPD event will be available on the SADA platform. If you are a member, just register on the SADA platform and you will be able to get your certificate there. If you're not a member, you can create a profile on the platform and you can get your certificate on that. Tonight's event, there's one CEU, clinical CEU point for this. And then at this stage, I'm going to hand over to Dr. Ahmed, who is the president of the Northern Cape branch. Dr. Ahmed.
Thank you, Dr. Swanepoel. Colleagues, I firstly want to thank you for joining us this evening, and I hope everyone is keeping safe and well. This topic is not a topic that most of us hear all the time when we attend webinars and conferences. It's something very rarely spoken about, but it's one that really does affect us in our everyday lives. It can really bring an end to our careers and cause tremendous pain to each and every one of us. And thus we felt that we need to have a webinar addressing this topic. You know, we're always hearing about implants and endo and things directly related to dentistry, but what about us as a dentist? What does dentistry do to us and how do we tend to manage it? And that's why we asked Francina and Mrs. Lee Scott to come and speak to us this evening regarding ergonomics in dentistry and how to manage it. How should you be seated behind your patient and that type of things. We're still waiting for a few more colleagues to join us. We're sitting at 198, and then we can hand over to Francina. But just to give you some background information, Lee and Francia started their company, Workwise Ergonomics, in 2019. They are both qualified physiotherapists with a certification in advanced occupational ergonomics from Colorado State University. They have presented numerous lectures in the field of ergonomics and in pain to the public, professional businesses, as well as to medical professionals. Individually, they have written articles for the Arthritis Foundation, Arthritis Insight magazine, on the topic of modern pain neuroscience. Lee has been in private practice as a physiotherapist for the past 20 years, and she is passionate about sharing knowledge and networking with other healthcare professionals. Francia has been practicing as a physiotherapist for the past 25 years, and she has a passion for striving for excellence and staying up to date on the latest research in her profession. I would like to welcome them today, and I would ask Francia to take over now. Thank you very much.
Thank you, Dr. Ahmed. I'm going to just share my screen with you. Good evening, everybody. Thank you for the introduction. I'm going to be starting tonight's talk, and then Lee will be taking over from me midway. First, we're going to just cover some of the topics that we'll be covering. First, we're going to be speaking about what is ergonomics and what's the definition of ergonomics. And then we're going to go on to why is this important in dentistry. Lee will then take over and speak about what can you do to improve your workstation setup and some exercises and advice that you can do at home and at work. So ergonomics, the word comes from two Greek words, ergos meaning work and nomos meaning natural laws. So ergonomics is the science of designing the job to fit the worker rather than forcing the worker's body to fit the job. So normally ergonomics will adjust the tools or the way the job is done to help minimize ergonomic risk. It draws from several scientific disciplines, including physiology, biomechanics, psychology, anthropometry, and so forth. And it forms part of what physiotherapists are normally taught at university. And most physiotherapists would include this in their advice when they're seeing patients. So just to summarize, ergonomics is the understanding of the interactions among humans and the other elements of the system. And it's a wide variety of industries where this can be of use. But tonight, obviously, we're going to be focusing on dentistry. So ergonomics usually takes a systems approach. So we look at the organization as a whole, the environment, workstation, and the individual. On an organizational level, we look at what is the culture in that organization regarding health and safety, and how can that be improved? How can different staffing scheduling be used to lessen the ergonomic risk, or how can certain tasks be changed to help improve the health of the workforce? In the environment, we look at what's the layout of the workspace and the design of the equipment and furniture that's used. But we also look at other things like lights, the temperature, and noise. For example, if you have to do very intricate work and your lighting is not sufficient, you may have to lean with your body to enable you to see. And if you had to persist in that posture for a long period, that can actually lead to injury or pain. On the workstation, we look at what's the setup of the different chairs or the furniture that's used, or what's the hardware or software that you're using. Nowadays, many people are using wristwatches to tell them what's their level of activity. But you also get apps that you can use on your laptop that gives you a warning, after, let's say, 30 minutes that, okay, it's time for you now to move a little bit. On the individual level, our nation is multicultural, and we've got different sizes and shapes. And that needs to be taken into account when you look at furniture. Most furniture is mass-produced, and it's made to fit the average person. So people on the extremes, the very short or the very tall, often have difficulty to get comfortable. We also look at the health of the individual, both the physical and mental, and what is the expectations of that person that's being assessed? What do they want to take from it? So the goals of occupational ergonomics is to increase the efficiency. How can the job be done in a more efficient and streamlined way to eliminate any unnecessary movements or muscle use? How can the quality of the product or the service be improved to decrease any risk of development of musculoskeletal disorders? We usually aim to prevent injuries and illnesses from happening in the first place, but if they're already present, how can we prevent any reoccurrences? And overall, we want to improve the quality of work life. Usually they say a healthy worker is a happy worker. And if you're healthy and comfortable in your job, you're more likely to be more productive. The topics that one would usually address would include working postures, what are the different postures that needs to be assumed to do the work, materials handling, what kind of materials need to be moved, or what instruments need to be gripped for how long, what kind of repetitive movements need to be done, what are the underlying work-related musculoskeletal disorders that are already present, and how can that play into the health of the person, and then the general layout of the workplace, just to mention a few of the things we would normally look at. So what are the advantages of ergonomics? First, we want to look at increased savings, or in other words, decreased cost. Whenever there's a musculoskeletal injury, the direct cost involved would include things like the workman's compensation payments, medical aid payments, any other medical costs. Let's say if you need surgery or need to see a specialist, or legal expenses if there was a death with the accident and something needs to be investigated. So those are the direct costs. But they found that the indirect cost of a musculoskeletal disorder can be up to 5 times that of the direct cost. And the indirect cost would include things like training new employees to take over for the person that's injured, accident investigation, loss of productivity, or if you're to repair or replace any damaged equipment. So the cost of a musculoskeletal disorder can be devastating. Other advantages of ergonomics can be that it can, hopefully you will have less pain. And if you've got less pain, you'll be more productive, and it will improve the safety climate of a company or of a practice. So in dentistry, normally we would look at the following things. How would dentists position themselves? How do they position their patients? What equipment do they use, and how is the equipment utilized? What's the layout and design of the work area? And how does all of these things come together to impact the health of the dentist and the dental assistant? I tried to find an example of how ergonomics increased savings in the South African setting, but unfortunately I couldn't find one in healthcare, but I did find one in the forestry industry. Many years ago, the University of Stellenbosch collaborated with an ergonomics company, and they did study in the forestry industry. This company had 300 laborers, and these laborers used axes or hatchets to debranch trees. And they found that they, on average, had 10 injuries per day, and each of these injuries required an average of 5 days sick leave per injury to recover. They then looked at the leg protectors that were being used and realized these leg protectors were imported from Brazil, but did not fit our multicultural workforce properly. So they redesigned the fasteners and the materials that they were made of, the leg protectors, and then they reintroduced them in a eucalyptus plantation. In the 6 months after the implementation of these leg protectors, they had 0 injuries, and the direct cost to the company was $250,000. And they now estimate that annually those leg protectors save the forestry industry $4 million a year. So that is just a small example of how ergonomics can cut costs. So all in all, good ergonomics is good economics. If we look at the reasons why dentists retire early, musculoskeletal disorders was the highest, rated the highest reason why dentists retire early, at 37%. In another study, the dentists who were surveyed, 93% of them reported they had at least one job-related ache or pain or discomfort in the 12 months prior to the survey. So musculoskeletal disorders are quite prevalent in dentistry. In this Greek study, they surveyed the dentists and 61% of them reported a musculoskeletal disorder. And of them, 69% reported pain in one or more body part, with the low back and the neck being the highest prevalence with 30%. And they found the predictors for developing a musculoskeletal disorder were awkward postures or static postures that were held for a long time, a lack of regular stretching exercises, and the number of patients booked per day. So all in all, musculoskeletal disorders can be quite devastating, but ergonomics can help you reduce your risk for developing a musculoskeletal disorder and hopefully help you have a long and healthy career. So when we talk about the musculoskeletal system, we look at the muscles, tendons, tendon sheaths, nerves, bursas, blood vessels, joints, and spinal discs, just to mention a few. And the common areas affected in dentistry would usually be the wrist and hand, elbow, shoulders, neck, and back. And the signs would include a decreased range of motion, loss of sensation, decreased grip strength, or loss of coordination. And the patient would usually complain of excessive fatigue in the shoulders or neck, or tingling, burning, or pain, cramping, weak grip, numbness, clumsiness, or hypersensitivity. So to summarize the risk factors for musculoskeletal disorders in dentistry, dental practitioners have been observed to hold postures that would require more than 50% of the muscles in the body to contract to enable them to hold that posture. Another thing was static gripping for periods exceeding 20 minutes has been found to be a high risk factor. And in particular, excessive use of a pinch grip seemed to be a big risk factor. Repetitive movements is defined as when you have to use one body part over and over again without rest or break for the muscles to recover. And the repetitive movements, we would look at not the frequency, but also the duration and the recovery. So frequency would be how many times are you moving your wrist in a certain way, the number of instruments you have to grip with one hand during the workday, duration, how long is a certain action performed, what amount of time you spend holding a specific instrument in a hand, what time are you spending in a static posture, or what is your total time of your workday. And then recovery, we look at how many breaks are you scheduling in between patients and what time are you spending stretching or walking around. So common awkward postures in dentistry would include extreme wrist flexion or elbow flexion, or thumb hyperextension, or awkward spinal positions. On the slide on the right, you can see that during resting and dynamic effort, the required blood flow and the actual blood flow are quite equal. But during a static effort, the required blood flow is much higher than the actual. So, and that can definitely lead to pain and symptoms, and in the long-term injury. So common awkward postures in dentistry, if we look at the shoulders, a rounded shoulders and a flexed thoracic spine can definitely compress nerves and arteries and veins, and that can lead to symptoms in the upper extremity. And with a slouched forward posture, you compress the chest cavity, preventing the diaphragm from completely filling the lungs with air, and that leads to diminished oxygen, and that can cause fatigue and a loss of concentration. In the neck, the normal posture, the neck would have a slight lordosis, which helps to balance the head over the rest of the body. But in a forward head posture, that lordosis is lost, and the position can cause strain in the joints and muscles of the neck and back, and can cause compression of the nerves and blood vessels as they exit the neck. And this can also lead to symptoms in the upper extremity and pain in the neck and the thorax. The low back, very few people come to us with a once-off injury of the low back. Most people have got an accumulation of awkward positions and postures over a lifetime, and then that accumulates and then presents in pain and symptoms. In the seated position, the pressure in the lumbar discs can increase to up to 50%. And then if you add to that leaning forward and a twisting motion, the pressure in the lumbar discs increases up to 200%. So you can imagine if that position is sustained for long periods, the risk of developing a low back problem is very high. So sitting, we in our modern lifestyle, we sit a lot. You sit in the car, you sit in the office, you sit on your stationary bike. And they found that people who sit too much have got a 2 times risk of developing colon cancer compared to healthy persons. They also have a 44% higher chance of rectal cancer. And they found that premature deaths due to inactivity to be the same as that for smoking. So that's why you will often hear people saying, sitting is the new smoking. So how much sitting is too much sitting? They found that there's a direct relationship between time spent sitting and your risk of early mortality due to any cause. And this was done in a study of 8,000 adults. They found that as your total time sitting increased, so did your risk of early death. And those who sat for more than 13 hours per day had a 2-fold greater risk of death compared to those who sat for less than 11 hours. But it's not only the total time spent sitting that's the problem, it's the bouts of sitting. So persons with uninterrupted sitting bouts of 30 minutes or more had the highest risk of death, especially if their sedentary time also exceeded 12.5 hours per day. So what is our take-home message from this? We need to move every half hour to combat the risk from sitting. So on that note, let's stand up a little bit, and I'm going to hand over to Lee.
Thank you, Francia. Okay, thanks very much. So that brings us to the application of ergonomics. So fitting the work to the worker, so the worker does not have to strain to perform the work, sounds pretty straightforward, but that often means as a dental practitioner that you'll have to rethink the way you work and the way you perform tasks. So what can you do to improve your workstation setup? We're going to look at postures, seating, patient positioning, instrumentation, scheduling, some pause and stretching exercises, and we'll do a little practical. If we look at postures, that's really the way to take care of yourself while you're taking care of others. And if we look at the parameters of a good working posture, we always want to try and stay as close to neutral positions as possible. So that means sitting upright in a symmetrical position as possible. And also when you perform forward movements to try and do that with a straight spine. The head can be flexed up to about 20 degrees. You want your shoulders relaxed, upper arms close to the body, elbows bent about 90 degrees, with the wrist in a neutral position. Your hips bent about 90 degrees or a little bit more than that. So you can also sit with your hips a little bit higher than the knees. The legs spread about 30 to 45 degrees so that you've got a good distribution of weight in that tripod pattern. Then knees and ankles also bent about 90 degrees or a little bit more, and feet flat on the floor. So if we look at those pictures at the bottom, it's okay to flex the head a little bit, but as soon as you move into those bigger ranges or further from your neutral position, that does mean that your muscles in your neck or in your back then has to work much harder. And keep in mind that your head weighs about 5 kilograms. So it means that if you're sitting with your head in a flexed posture, there's about almost a 17 kilograms of force on the back muscle. So your back has to support 17 kilograms for that time that you're flexing forward. And again, if you're doing that for prolonged periods of time during the day, those muscles will fatigue and tire and can lead to injuries or pain. So if we look at the trunk, again, try and avoid those excessive movements, keeping the elbows close to the body, try not to move too far out, relaxing the shoulders. So you want to avoid pulling the shoulders up to the ears, and also to make sure you're sitting on both the sit bones so that you're not leaning your trunk far to the left or the right. And then also with the elbow, it's okay to flex, but you want to try and avoid those extreme positions. So seating can be complex. Like Francia said, there are so many shapes and sizes, and you really want to make sure that the chair that you have really suits your shape and size. And the ideal is to alternate between active and passive sitting postures. So your active sitting posture is where you're sitting without a backrest, so your muscles has to support your body for that period. And you can either look at a saddle chair, which is some of them are just fixed, but they can move up and down. Other ones have a little bit of a tilt, so you can also tilt your seat a little forward so that your pelvis is in a more neutral position, or then your rounded chairs, which we're all familiar with. If you look at passive postures, there you're usually sitting with your back supported against the backrest. So it can either be a kidney type of back support or your typical office chair kind of support. And the base of your dental chairs is usually a little smaller than the typical office chairs, so that you're not bumping into things when you've got to move around your patient. And then also, if you're looking at chairs, you want to make sure the seat pan also suits your body. So some people who are very tall would probably require a slightly bigger seat pan so that you're supporting your side, the whole area, that you're not having too much pressure on the hamstring. Ideally, you want to have a little bit of a waterfall edge or slant with the edge slanting a little forward, also then just to reduce that pressure on the leg. And some of these chairs can be specially made up for you to suit your size, and you'll have a choice of a backrest, without a backrest. So we're very fortunate in the Western Cape to have suppliers who can custom make these type of chairs for us. Then patient positioning and posture. So you want to be as close to the patient as possible, and try and minimize that forward bending or excessive leaning. Try and keep the patient more in a horizontal position so that you can sit nice and close to them. And again, you can use each arm equally. If you're working close to your body, keeping in mind that 90% rule, so you want to keep your elbows, hips, knees, and ankles bent about 90 degrees, and make sure you can reach the patient and your instruments easily. And remember, it might not be possible to maintain that perfect 90-degree angle all day, but you want to try and stay as close as that as possible to maintain that neutral spine, because that's where your body will use the least effort. And then also alternate your work positions. So you want to alternate between sitting, standing, and maybe the side of the patient that you're working. So if you're moving from one position to another, you're relaxing some muscle groups that's been working hard, shifting the stress to new groups, and that'll give the muscles that has been working hard a chance to improve their circulation again, oxygenate them, and a little bit of recovery time. Try and adjust the height of your and your patient's chair to a comfortable position. If your chair is too high and the patient is too low, you might end up with a position where your neck is having to flex quite far forward, with your wrists having to extend to be able to reach properly. If your chair is too low and the patient is too high, you end up elevating the shoulders and having to flex your wrist to be able to reach. And then also check your lighting. You want to check the placement so that you're not going to end up having to strain your neck to be able to see properly. We're going to look at the 4 pictures there on the screen. I'm going to give you a few moments to see what you notice. We're going to think about the good points and also the bad points of the neck positions, the shoulders, the elbows, wrists, the chair position, and also their postures. So take a few moments and just have a look what you notice there. If we start at the picture at the top on the left, if we look at the position of the dentist there, she's sitting quite far away from the patient, which means she's having to lean quite far forward with her neck and her trunk to be able to reach. You'll see her elbows are quite far out from her body, so you can even see there how she's having to strain her neck to be able to support her arms there. And then also it's going to put a bit of strain on her grips, having to work in that position. If we look at the assistant there, a standing position, having to flex the trunk forward, and then also with that right hand quite far out to the side. Again, she's going to have to work very hard with those back muscles and neck, and especially that right shoulder. If we look at the picture on the right, again, you can see she's having to lean quite far to the side, far away from the body, and one can even see the fingers there having to work quite hard to grip the instrument. So there you're going to get a bit of strain on the fingers as well. If we go to the bottom picture, that's definitely a better position. She's moved a little closer to the patient there, not really using the back support there at the moment. But we also have to keep in mind, dentists move about every minute during a treatment session. So you're not always going to be able to sit with your back supported, but try and at least sit back from time to time so that your back can have a little rest. And the ideal would be to sit right back against that backrest. Shoulders are definitely in a slightly better position there. That left arm again is going to have to work quite far away from the body. The neck is going to take some strain there with the very far flexed position. And then the assistant there you can see is really not comfortable having to lean to the side. And again, that arm far away from the body has put a lot of strain on the shoulder structures. And even the wrist there has to deviate a bit to the side to be able to hold the instrument. If we look at the picture at the bottom there, they look pretty comfortable there. If you're looking at the dentist and the assistant, she's sitting with her back well supported, nice and close to the patient. Arms is next to the body, elbows is flexed but not too much, wrist comfortable, and the same for the assistant there. We're going to look at another 4 pictures. Number 3A and B, we're going to focus more on the dentist. So you can have a look again there at the neck position, the shoulders, elbows, wrists, chair position, and the posture. And then for A and B, we're going to focus more on the dental assistant. I'll give you a few minutes again, just notice the good things and also the bad things you can spot there. So if we look at that picture, number 3A, the good thing is she's sitting nice and close to the patient, so you're able to reach. But again, the trunk is having to flex quite far to the side. Elbows are again, very far away from the body. And you can also see that left wrist is having to deviate and extend quite a bit to be able to manage the instrument there. At the bottom, number 3B, she definitely looks a lot more relaxed there. Again, not using the backrest, but she's nice and close to the patient in a neutral trunk position, arms in a good position. Neck is a little flexed, but also not too much. And the assistant in both cases is in a very good position. In number 4, we can see, if we look at the assistant, she's having to flex a little bit forward with the trunk and the head. And that's probably because her knees are facing the patient, kind of pushing her a little bit further away from the patient. So to kind of counteract that, she swings her knees a little to the side to be able to move closer. And that also helped her then to have a better upright posture. She's also sitting a little higher than the dentist to be able to have a better view over the hands of the dentist, to be able to see comfortably. And you can see her arms there are looking quite relaxed and comfortable. So if we look at instrumentation, instruments are often designed with function in mind and not necessarily ergonomics for the user. You want to look at lighter, larger diameter instruments, particularly those with a textured grip surface that are easier to grasp and that can reduce the amount of force needed during procedures. Maintaining your instruments' sharp working edges is critical, also to reduce fatigue. If your instruments are not properly sharpened, it will require you to apply a lot more force to achieve the same result, which again can increase your risk for musculoskeletal disorders. And then make sure that your frequently used items are fit within comfortable reaching distance, so that you're not having to lean far forward or stretch to reach them. And again, to be able to maintain that neutral posture as far as possible. If we look at the wrist position, your ideal position, you want to keep the wrist in a neutral position, palm nice and relaxed and open, and the fingers also relaxed and in a rounded shape. We'll have a look at those hyperextended positions in a moment. So looking at the wrist, your strength is definitely best in that neutral position. And as soon as you move into your extremes of flexion and extension, you lose some grip strength. So even just for being efficient, it's much better to keep your wrist in a neutral position. So you want to try and minimize those excessive movements into flexion, extension, deviations, as well as rotations. If we look at the picture here, you can see her wrist is flexed quite a bit there, and that again can cause some compression on the neurovascular structures in the carpal tunnel, the tendons, so that could lead to injuries. If we look at the fingers, excessive forces together with the amount of repetitions that you perform every day can definitely lead to strain at the end of the day. So you want to avoid the excessive finger movements. You might end up having to perform all those repetitions, but at least if you can avoid the excessive forces, then you're already going to decrease your risk for injury. And you can also think about rather using your arms and your shoulders to position your hands rather than just using the fingers on the wrist. You want to avoid some hyperextension. So hyperextending the joints can also lead to injuries. And also look out for those sharper edges of the instruments. Some of them are rounded, others have got little ridges on them. And the harder your force is, the less your circulation is going to be to the fingers as well, and to the thumb. So look out for that. And then properly fitting gloves are really important. If your gloves are too small, again, it's going to restrict your circulation. And it can also put quite a lot of pressure on the base of the thumb, which can lead to injuries and to pain. So the ideal would be to have your left and right fitting gloves rather than a glove that would fit either, because then it also kind of expands with your hand and allows better movement. If your glove is too big, again, it can cause a bit of bunching, and it will also affect your efficacy with your grips. And check the temperature. Make sure it's not too cold. That can also restrict your circulation to the extremities. scheduling can be a lovely preventative measure. Think about incorporating some short or brief stretch breaks during your day between patients, and that'll give your body a bit of time to recover. So during your break, you can do some non-stressful exercises, do a bit of stretching, just walk around the practice a bit, do some relaxation techniques, or just rest your hands for that little while. And it doesn't necessarily have to be a very long break. It can be anything from 5 minutes to 15 minutes to just give you a little breather and time to recover. Try to apply some pacing, so that helps you change the stresses on your body and again gives you some recovery time. You want to alternate between difficult and less difficult patients, light and heavy work, and try and increase your treatment time for those very difficult patients. And try not to schedule them one after the other, which will give you some recovery time. Alternate between procedures and other tasks, like your administrative tasks and patient charting, for instance, again, just to change the loads and the muscles used for various tasks. That brings us to some pause and stretching exercises. So one study by Sanders suggested to lean back in your stool at least 4 times during each treatment session and to spend 3 to 5 minutes of stretching between each patient. And that could really help to reduce your risk for injuries. So points to remember with stretches is to include a variety of stretches throughout the workday. Some people might have to stretch all those different areas. That takes a bit of strain. Others might have certain problem areas that would need more attention, or they just like to focus on that. But it's really going to depend on the individual. Want to perform your stretches gentle and gradually. Try not to stretch into pain or to the point of pain. As soon as you move into pain, the muscle is going to want to brace to protect itself. So you might end up almost arm wrestling with the muscle. You really only want to take your stretch to the point where you feel a good or a comfortable stretch, and then try and maintain it for about 20 to 30 seconds to give the muscle a good chance to lengthen. And you can repeat your stretches anything from 1 to 3 times, and also remember to breathe. Many of us forget to breathe and end up holding our breath. That brings us to a little bit of a practical exercise. So as Francia explained before as well, if we're looking at that flex posture with your chin poking a little forward, your shoulders rounded, that often then leads to tightness in the pectoral muscles, the chest muscles, as well as those upper trapezius and levator scapular muscles. And together with that, we get weakness in the deep neck flexor muscles, as well as those lower trapezius muscles. So the easy little exercise that you can incorporate during your day is when you're sitting on your stool or on your chair, is just to lengthen yourself. You almost want to pull yourself by your hair up towards the ceiling, and then automatically your chin comes in a little bit. You can think about pulling your shoulder blades a little bit down towards the spine and together, and also pull your belly button in towards your spine. And if we think about 100% contraction, which would be pulling the belly button in as hard as you can towards the spine, you only really need to do about a 20% contraction of that. And of course, you're not going to be able to maintain that position the whole day. You'll be tired and fatigued. But if you can apply that for 10 to 20 seconds every now and then during the day or between patients, you're already going to build up a bit of endurance in those muscles, which is going to help you to support your posture throughout the day. We're going to look at a short video of some suggested stretches, and keep in mind with any new exercises, there's always a risk of injury. So if you're sitting on a chair with wheels, make sure your chair is not going to run away with you. Make sure your arms has got a little bit of space to move, that you're not going to knock yourself against something. And also keep in mind, our bodies are all different, and some people might have restrictions in their joints, like your neck might be a bit stiff, or your shoulder can't move all the way up like everybody else's. So just respect those limitations. Don't try and force any of the movements. Just go to the point where you feel comfortable. So you might have to adjust some of the exercises that we suggest you. So we're going to take a few minutes, and you're welcome to try the stretches with us. That brings us to our first stretch, the wrist flexor stretch. Stretching the arm out in front of you, keeping the elbow straight, pulling the fingers back until you feel a stretch in the forearm, and you would hold that for 30 seconds. The next stretch is more just for the fingers, so with the elbow flexed, you're going to maintain the wrist position and then just pull the fingers back to get a better stretch over the palm and over the wrist. And again, hold for 30 seconds. Next stretch is for the wrist extensor muscles. We're going to stretch the arm out, elbow straight, going to make a loose fist with the hand, and we're going to pull the fist back until you can feel a stretch in the forearm muscles. And again, we'll hold that for about 30 seconds. Next, to do more the finger extensor muscles, we're going to keep the elbow flexed about 90 degrees, making a fist and just bending the fist down towards the floor, and again hold that for 30 seconds. The next one is for the thumb muscles. The muscles in the base of the thumb usually get very tight, so we're going to pull the thumb back until you can feel a stretch in the web space, and again hold for 30 seconds. Next up is the neck muscles. For this stretch, you can either hold on underneath your chair, or you can just keep your shoulder down. You're going to pull the head away from that shoulder until you feel a stretch. If you don't feel much of a stretch, you can place your hand over the head and gently pull on the head until you feel a stretch. And again, hold for 30 seconds. Our next stretch is more for the levator scapula, which comes up from the shoulder blade up to the neck. So the same position, holding on underneath the chair, keeping the shoulder down. This time you're going to look down towards your hip, placing your hand over the back of your head and gently pull down while you're looking down towards your hip, and hold for 30 seconds. Next up is a bilateral stretch for the trapezius or the rhomboid muscles. Interlace your fingers, keep the shoulders down, and push both the shoulders forward, opening up the shoulder blades, and again hold for 30 seconds. Next is another stretch for the muscles between the shoulder blades. This is the eagle arm stretch. We're going to cross one arm or elbow over the other, place the fingers in your palm. You can have your elbows at about shoulder height or a bit below that. You're going to push your hands slightly away from you. If you feel a good stretch, you can hold it there. If you don't feel much of a stretch, you can also raise your elbows a little bit, opening up the shoulder blades until you feel a stretch, and then hold for 30 seconds. Next is for the mid and lower back muscles, so you can maybe just sit with your legs a little bit wider apart. You can hold on to your chair if you want for balance, and we're going to stretch over and across towards the front. And hold that for 30 seconds. Next up is for the mid or lower trapezius and mid back muscles. For this one, if you have a space to hold onto your chair, underneath your chair you can. If you can grab the legs or just underneath your seat, and you're going to push your spine up towards the ceiling until you feel a stretch between the shoulder blades. Again, opening up the shoulder blades, pulling them away from each other, and hold for 30 seconds. Next up is for the buttock muscles. We're going to cross one leg over the other, grab your knee with both the hands, and then pull the knee towards the opposite shoulder and hold for 30 seconds. Just make sure not to lean away from that buttock. You want to be sitting on the buttock, and hold for 30 seconds. And then of course repeat on the other side. The next one is for the piriformis muscle, which comes from the coccyx towards the hip. For this one, we're going to cross over again, sitting upright, and you're going to lean over towards your foot until you feel a stretch in the buttock, and again hold for 30 seconds. Next is a mobilization exercise for the thoracic spine. We're going to place the fingers at the back of the spine, opening up the shoulders, and we're going to just open up the chest Extending the upper back a little bit, holding it for about 2 to 3 seconds, and relax. And again, opening up the chest, opening the elbows, hold for 2 to 3 seconds, and relax. And this you can repeat, just doing it a few times in between patients, or if you have the time, you can repeat about 10 times. Next up is also a chest opener. If you interlace your fingers behind your back, palms facing down towards the floor, and you're going to open the chest and move the hands a little bit away from you until you feel a good stretch over the chest area. And again, hold for 30 seconds. The last stretch is more a hip flexor stretch, because we in a sitting position most of the time, the hip flexors tend to get a little stiff. So for this one, you can move your chair away. You're going to stand one leg in front of the other, almost like in a walking stance, keeping the hips square to facing the front. And you're going to tuck the pelvis in to push the groin area forward, and then lean slightly forward, putting your weight on the front leg until you feel a stretch in the groin area, and hold for 30 seconds. Thank you. I hope you could all follow that and try some of them with us. It will also be interesting if you try these at home to see how the left and the right side of your body compares. Often our dominant sides are a lot more stiff than the non-dominant side, especially those forearm flexors and extensor muscles. So we'll be sending you a PDF document after the webinar with all the stretches that we did together now. So you can really take your time to go through them again, try them out, even put them up in your practice somewhere to remind you to do them. So you'll have all of those to keep with you. Then mindfulness and abdominal breathing is another good way to help our bodies move from that fight and flight state more to rest and digest, especially in these times we're living and working in. Our sympathetic nervous systems tend to be a bit more overactive, so we want to move more towards the parasympathetic state. And it can be something as simple as just taking a pause, doing some breathing, and just noticing what's going on around you. The easy grounding exercise you can do is by simply naming 3 things around you that you can see, that you can smell, that you can hear, and that you can feel. And then just doing some slow breaths in and out while you're doing that. Another good exercise to do for mindfulness, and also just to calm the whole nervous system down, is some abdominal breathing or diaphragmatic breathing. So we're going to inhale through the nose, really drawing the breath deep into your belly, blowing your belly up as big as you can, and then exhaling through the mouth, deflating the belly again. And while you're doing the breathing, listen to the sound of the breath going in through your nose and out through your mouth. I'd like you to try about 5 breaths together with me and listen to your breath, and also just notice what's happening in your body afterwards. See how you feel. So we're going to inhale through the nose and exhale, and blowing the belly up, and exhale. So inhale, blowing the belly up, and exhale, deflating the belly. Listening to the sound. And again, inhale. And exhale. And last one, inhale. And exhale. So just take a moment and notice what you're feeling. You might have felt your shoulders dropped a centimeter or 2. You might feel a little warmness somewhere in your body, or a little bit of tingling. So even 5 or 6 breaths is more than enough to calm your nervous system down. And that's such an easy way, even while you're busy with patients. If you're struggling with those very difficult patients and you're not in a good space yourself, even while you're doing your treatment, that's one way to calm your nervous system down. And then in summary, begin to make small changes in the way you practice. You might not be able to implement everything we've suggested today, but even if you just start with one or two things, you might find at the end of the day that you're less fatigued, you might have less aches and pains, your quality of service could improve, and it can enable you to have a long, healthy, and a successful career. Gradually increase your work tolerance when you're returning to work. Some practices might already be busy full steam, and others might be building up towards that. So just keep in mind to rather gradually increase your time spent doing certain tasks and activities so that your body has time to adjust to the new stresses. So that brings us back again to our goals of ergonomics, as Francia explained in the beginning as well, which is to increase your efficiency, to improve your quality in work, to help prevent injuries and illnesses, and also to improve your quality of your work life. So as Workwise Ergonomics, we can offer you the following services. We do assessments of workspaces, either at work or at home. At the moment, online is definitely easier. We can do some recommendations on adjustments you might want to make. We can do suggestions and help with the sale of office chairs and accessories like your footrest, screen raisers, lumbar supports, pillows. We didn't really chat about the administration staff and their positions and what one needs to look at. So that's also something to keep in mind. Other applicable advice like the exercises we've gone through, you might need a little bit more specific advice. And we can do some screening for risk factors and also assist in implementing a health and safety policy, specifically in regard with ergonomics. And then we really enjoy sharing knowledge, education, and presentations on neuroscience of pain and or physical and occupational ergonomics. And that can be at the workspace, conferences, or webinars. So thank you very much for your time, for listening to us. I'm going to hand over to Dr. Sonneville to take us to the questions.
Dr. Ahmed, will you just thank the presenters before we go over to the questions?
Thank you so much to Lee and Francia for giving us that wonderful presentation. I know that I will definitely be implementing it in my practice. One point to add on that is for our colleagues not to forget the importance of microscopes and loops and the importance of magnification, because that definitely helps in keeping the neck in a more restful position. Thank you, Dr. Sonneville. We can see if there's any questions. I think we have one so far.
Thank you, Dr. Ahmed. As this presentation was done, I was sitting upright trying to do what was said there, and I must tell you, it's quite refreshing to do it this way. There's a question. The first question is, can you recommend a company or physiotherapist in Johannesburg area who specializes in ergonomics? Lee of Francia, do you know anyone there?
I'll take this question. Most physiotherapists are trained pre-graduately in ergonomics, and some of them then go on to do extra training. At the moment, I don't have a specific company in mind, but if there's, people can always email us, and we can search for people in Joburg and forward the information to them.
Thank you, Francia. There's another question that says, with the masks that we're wearing, I just want to the effect of reduced oxygen during the wearing mask and facial seals. Do you have an answer on that?
That's a tricky one because we do need to wear them at the moment. I think that comes back to your breaks again. If it's possible to schedule patients in such a way that you do allow some breaks for yourself in between, to take your PPE or your mask off and to have a little bit of breathing time in between, and maybe even do a breathing exercise or two, I think that could be something to keep in mind.
Thank you, Akli. Can I just ask you to bring your mic a little closer to your mouth? They were complaining they couldn't hear you properly there. Thank you.
Sorry, my mic is on my camera, so I'm going to bring my screen a little
Okay.
closer. I don't know if that's any better.
The question is there a recommended time frame per day we should be working for the type of work we do?
I will take that question. I think it is such an individual thing. There's no one size fits all. So it depends on the person's underlying health and what musculoskeletal disorders do they have already. And it also depends on the type of patients and procedures you're doing. So I think the rule of thumb is to move every 30 minutes at minimum, and then definitely every hour. And then, yeah, there's no fixed time for you should only be working 8 hours or you should be working 10 hours. That's a very personal thing. I don't know if that answers your question.
Thank you, Francia. No, definitely. I'm trying to go through all these. Okay, it seems that's the questions that we have. If there's no further questions, I think we can wrap this presentation up. Thank you, Francia. Thank you, Lee, for what you've taught us here tonight. I just want to say that this presentation will be available on YouTube as well. And for the participants, just to remind them, there's 3 more upcoming presentations. On the 25th of August, it's the Mpumalanga branch CPD meeting. On the 26th of August, it's the financial work stream with the Deloitte. And on the 27th, the Young Dentist Council CPD meeting there. I see there's another question. Oh, it's just to thank everyone. It says it was a great presentation, so important. Thank you.
Thank you, everybody.
Thank you.
Thank you, everyone. The panel, just stay on. Thank you.